world, you don't get blue and red. Not so much, okay?
That is true.
So, we're going to use this as a exercise and to make sure we know everything, but you need to know them on a real heart. So take pictures of a real heart and know the real heart, because the lab practical is going to have real hearts on it. And if you don't like the smell, too bad. I don't like the smell either. We're going to live through it together, okay? But we are going to have our lab practical is going to have real anatomy on it. It's not going to be just modeled, okay? All right, so first and foremost, we have three major conducting arteries and veins coming into the heart. What is this first one? Superior vena cava. Okay? What's this one right here?
Aorta.
Okay, that's your aorta. What's this right here? That's your pulmonary trunk. Okay, now, straightforward so far, right?
Mm-hmm.
Okay, what's this right here? Okay, it's an auricle. It's the right auricle. Okay, this is the left auricle. Okay, now, let's see, I had you guys do a couple of these. What is this main artery that comes right under this right auricle? It's the right coronary artery. What's the one that comes right down here? What? The interventricular? Is it? It's right in front of you. Okay, the interventricular artery. Okay. You know how you know that?
That was me. This is why I don't bring some.
I'm not laughing at you, I promise.
No, I am totally laughing at you.
Okay. That goes my notes.
Okay, so you guys remember your interventricular septum, right? Okay, you have a lot of tissue, a lot of heart muscle right down there. This is the main blood supply to that. That's why it's called the interventricular artery. Okay, makes sense. Okay, if we turn around to the back of the heart, what is this? This extra large vein across the back of here. Yes, it is the coronary sinus right across here. This collects most of the blood from the heart. Okay, remember I told you the the heart itself needs blood supply in order to function properly, right? So these two major arteries, you have to know them. Okay, the one that comes right under the auricle, that's your right coronary artery. And then you have your interventricular artery. Okay, and then in the back you start collecting this. This is your coronary sinus. Okay, that is part of the great cardiac vein, right? Where did my auricle go? Thank you. Okay. So we've gone through the external parts of the heart, right? Now we open up the heart, okay? And you can see a couple of different things. What's this chamber called right here? Huh? This one right here. Right under the auricle. This is your right atrium, right? This is where all the blood dumps into your heart. That's deoxygenated, correct? Okay, there are two major points in here. Okay? Yeah, there are two nodes. They are going to be very difficult to see even on one of these models. Okay? What are the two nodes? Okay, so your SA and your AV node. Most of the time, those are going to be denoted, they will be colored in a model if we use a model, right? It's going to be very difficult for you to identify them in a actual heart. All right, so I am going to probably ask you questions about those, so please be familiar with the SA node and AV node. Which one's going to be in the back wall of it, or the back wall of your atrium? That's the SA node. The AV node is actually closer to your interventricular septum. Remember that? So it'll be closer. Remember, it goes from the SA node, travels across the atrium to the AV node, right? And it goes from the AV node down your interventricular septum to the apex of your heart. and it goes around the apex of the heart and hits all those Purkinje fibers, correct? And that's where you get most of your electrical signaling. That is the path, okay? Hey. All right, so coming from the atrium, what is the valve we hit first? It's a tricuspid valve. It's got another name. It is a mitral valve, okay? You can use either one, but definitely use one of them. Okay, so we come through the tricuspid valve, and you guys can see it here. It's in pieces. That's why models are so wonderful. I'm going to have to do some real repair to this. Okay, what are the little projections coming off of your valve going to the rough part of the heart called? Okay, those are the parts of the heart. So if you see, first off, we'll start easy with this. Going or looking at the inside of the ventricle, you have rough tissue, right? The inside of that ventricle looks rough, and you feel it, it's rough. What's that called? What's the tissue? Trabeculae carnae. And in the trabeculae carnae, you have large projections, right? What are those called? No, y'all are too far. The large projections in the trabeculae carnae. Those are the papillary muscles. Those attach to the chordae tendineae, which is where you're attaching your papillary muscles to your valves, right? Okay. So I definitely want you guys to be able to identify the papillary muscles, the chordae tendineae, and where it attaches to the valve. You also need to know the trabeculae carnae. Okay, when your heart beats, the ventricle is going to be ejecting blood from it into what? Okay, we're in the right atria. We go into the right ventricle. Your heart beats. Where's the blood go? It goes into the pulmonary trunk, right? Now that pulmonary trunk, to get into the pulmonary trunk, you have to go through a valve. What's that called? Which semilunar valve? A pulmonary semilunar valve. That is absolutely correct, right? Where does it go from there? Well, where does it go first before it gets to them? How about your lungs? What does it pick up in your lungs?
Oxygen.
Okay, so you're picking up oxygen in your lungs. It's kind of important, right? We don't want to skip that step. Okay, so you pick up oxygen, you come back through the pulmonary veins. Where do they dump into the heart? Okay, you can see right here into the left ventricle, you got your pulmonary veins dumping into the left ventricle, right? Now, is that oxygenated or deoxygenated blood?
Oxygen.
It's oxygenated. So this is the only place in your body where veins carry oxygenated blood, right? All right.
Is there a vein that takes it to the lung circulation, whatever, pulmonary circulation? Is there something that takes it up there that's called the pulmonary artery or no?
Okay. There is the pulmonary trunk, and that splits off into pulmonary arteries. Those arteries carry deoxygenated blood. So the only place where you have an artery carry deoxygenated blood is going from the heart to the lungs. The only place where you have veins carrying oxygenated blood is going from the lungs to the heart. Okay, that's it. It's the only place in your body where everything is backwards. Okay, it's like the Twilight Zone. You guys are probably too young, but Dr. Ingram knows the Twilight Zone used to be a great show, especially when it was in black and white. Okay, so your pulmonary veins dump oxygenated blood into the left atrium, right? Okay, so left atrium is going to dump blood into the left ventricle. What valve does it go through? It is the bicuspid valve. Okay, now you go through the bicuspid valve into the ventricle. Okay, your heart beats, it ejects blood through. It is another semilunar valve. This is the aortic semilunar valve, and guess where it's going? It goes into your aorta. Now, when I had to learn the heart, I had to learn all of the branches on the ascending aorta, and you had 3. Okay? Went into the brachiocephalic, I believe. This is the second one. This is one of the carotid, and there's one more. What's the other one? Subclavian. Man, I remember all 3 of them, and I haven't even looked at that in years. Okay? You guys with me? Okay. So those are the 3 branches off of your aorta. Now, remember, the aorta is pretty elastic, right? Why does it have so many elastic fibers? Because you're trying to absorb some of that pressure coming out of your heart, so you're not going to be bursting arteries going down the line, right? Makes sense? Okay, so all of that is absolutely testable material, okay? For the practical, what? You're talking about the test we have on Tuesday? Yeah, the heart will be on the test on Tuesday, but not that much. This is more, anatomy is going to be, we're going to cover a lot of anatomy in lab, and we're going to cover quite a bit in lecture, but I'm going to focus more on the anatomy in lab. Okay, so if we're doing specific parts, I would like to do that more in lab and not so much in lecture, because we have lots of physiology to cover in lecture, right? Okay. Any questions about the heart?
Do you have to know the branches of the aorta?
Not at this point. Okay, I might add it later, but not right now. Okay, at this point, no. All right, that's it for the heart itself. I want to get into right now doing heart anatomy. So we are going to break up into our regular groups, and you guys are going to start dissecting a heart. Okay, so grab your lab manuals. There are lots and lots